Hello, Mr. Bear. My name is Trisha and I'm with Respiratory Care. Today we're going to be doing some medications the doctor would like you to have that are going to kind of target your breathing. So it's going to help you breathe a little bit easier, maybe not wheeze so much. Sounds like you've been feeling a little short of breath lately, so we're going to kind of target those with some of these medications. So first of all, Mr. Bear, can I get your name and date of birth? All right, so first one we're going to start with is what we call Acunab, and this is an albuterol inhaler medication that's going to go right into those lungs, and it's going to stop, sometimes you might feel with that wheezing or that shortness of breath, things are tightening up in your lungs, so it's going to open those airways up, get you breathing a little easier. So with this particular one, like I said, we're going to breathe it right into the lungs, but first I'm going to get some vital signs from you. I'm going to listen to your lungs. Take a big deep breath in and out for me. Good. Very good. Listen to the front side. Very good. Now I'm going to get a pulse here. Good. And then check the oxygen level on your finger with this little device here. Good. Okay. So with this one, like I said, we just inhale this directly into the lungs. There's medication in this little cup here. And then when I hook on to our oxygen source, there'll be a little mist, and we want you to breathe in this mist. So we'll have you seal your mouth tighter on this mouthpiece. Breathe in normal, but every so often I want you to take a big deep breath in for me, okay? All right, so let's start this one. This takes about 10 minutes to complete. Big deep breath in for me. Very good. Okay, good job. Can I have you take a big deep breath in and then cough for me? Good job. All right, so I'm going to take a listen to your lungs quick here and see if that helped any of that wheezing. Good. Big breaths in and out. Good. I'll listen to you in the front here. Good. And then I'll get the heart rate again. Sometimes with this medication, it can increase your heart rate a little bit. Give me just a second here. Very good. So it can increase the heart rate, kind of make you feel jittery or get a little bit of tremors. So if that gets to be too bothersome or gets to be too much for you, just report that and let us know, okay? So then the second medication we're going to have you do today, this one is called Spiriva. So the first one we did, going to open up those airways right away for you. That lasts about anywhere from 5 to 12 hours. So we're going to do that one 4 times a day. So you're going to see me about every 6 hours. We'll do that. The next one, this is what we call Spiriva. This is another what we call bronchodilator that goes into the lungs. It kind of opens them up. But this is a little bit more long term. So with this one, it's about 24 hours that it lasts. So we're going to take 2 puffs of this twice a day. So this one actually, this one lasts the 12 hours. So we're going to do 2 puffs twice a day with this one. So with this one, it's what we call a small mist inhaler. So we have our little medication cup in there. We're going to twist it to activate it. And then what I'll have you do is I'll have you take a breath out and get all the air out of your lungs. And then I'll have you take a deep breath in with this sealed around your mouth. Big deep breath in, hold it for 10 seconds. And then after that, I'll take this away from your mouth and then you're going to breathe out for me. We don't want you to breathe out near the inhaler itself. All right. So when you heard me do that twist, and then we'll push this button as you inhale, okay? So go ahead and take a breath out, get all the air out of your lungs, seal around your mouth. Big breath in, push that to activate that. Good, breath in, hold for 10 seconds, and breath out for me. Very good. Take a big breath, deep breath in, and cough for me. Good. Take another listen to your lungs real quick here. Big deep breath in and out. Good. Very good. Good. All right, I'm going to get that heart rate again. So with this particular one, sometimes it can give you a little bit of a cough or make you feel like you have a dry mouth. And that's okay, but if it gets to be too bothersome, be sure and let us know. We can maybe do some adjusting to your medications. So now we have one more medication. So your first one was immediate acting. Second one is over time, it's going to help kind of prevent those lungs from tightening up on you. the last one that we're going to do is what we call meter dose inhaler. So it's just a little inhaler like this. We're going to use what we call a spacer on it. So if we push this, it's going to push out some medication. So we want to put it in here, kind of hold it in here, because what you're going to do is you're going to push this down and breathe in at the same exact time. So sometimes that can get a little tricky. So we want that medication in here so that when you're ready to take a big deep breath in, it's there, it'll go right into those lungs. And this one is more long term to affect the inflammation. So this one's going to target, because your lungs are tightening up on you, it's most likely inflammation. So we're going to target that inflammation, and over time this will help reduce that inflammation overall for you. So with this particular one, we're going to do 2 puffs twice a day, morning and night, just like with the other one. And with both of them, actually, you're going to do your puff or push your button and inhale, wait a minute or 2, and then do the second one. Don't do them back to back quickly. And this is the same concept. Blow all the air out of your lungs, seal this around your mouth, push and take a big deep breath in with the medication, hold your breath for 10 seconds, and then after that 10 seconds, breathe out away from this inhaler. So I'm going to take this piece off here. And again, this one is Symbicort. This is the steroid for the inflammation. So big deep breath out, seal this, push, breathe in, big deep breath in, hold it for 10 seconds, take that away and breathe out away from that. Again, we don't want to breathe out breathe out into this inhaler here for you. This one, again, this is a steroid, so this can build up in your mouth at times. So every time we do this, we're going to take a drink of water, rinse it out in your mouth, and spit it out. So here's some water. Take a drink of water. All right, rinse it out, spit it into here. Very good. So like I said, it can just kind of cause like a thrush type infection within the mouth, or yeast infection in the mouth. So we don't want that to happen. Sometimes the other thing that can happen with this can kind of decrease your immune system a little bit with that steroid use over time. So if you start noticing, recurrent illnesses, just mention that to your doctor. I'm sure he'll know too, with having you on that Spiriva, that could be, or I'm sorry, that Symbicort, that could be kind of a side effect. So do you have any questions at all for me? Okay, so you will see me again, like I said, in 6 hours for the one that was this nebulizer, that inhalant mist that we did at first. That's every 6 hours. And then you won't do the other 2 inhalers until tonight, because you'll do those morning and night. So if you have any questions or you need anything, let us know. One thing I'm going to do is take one last listen to your lungs and get that heart rate. Big deep breath in. Good. Very good. All right. Kind of doing things a little backwards here. Okay, we are good to go. All right, be sure and let us know if you need anything. Thanks, Mr. Bear.